Hi everyone, my name is Jacqueline Prabaharan and today I will be sharing my reflection on a subject that's not only critical in health and social care but also in our everyday lives, non-verbal communication. In the next 10 minutes, I will walk you through what is it, how it works, where it can fall short, and more importantly, how we can improve it to provide better, more person-centered care. Introduction. When we think about communication, we often imagine speaking or listening. But here is the truth. A large part of what we communicate doesn't come from our words. It's come from our expressions, our body posture, the tone of our voice, even the silence between the words. In health and social care, this becomes even more important. Emotions are raised, words may fail, and some individual may not be able to speak clearly, even at all. That's when non-verbal communication step in. We all do this every day, often without realizing. It's allow us to build trust, show empathy, and connect deeply with those who are vulnerable. It is not a skills, it is a lifeline. Definitions and characteristics. One of the pioneers in this field, Michael Ackley, described nonverbal communication as the transfer of message without word, using gesture, tone, facial expression, and body movement. Here are 6 key characteristics to keep in our mind. It is often unconscious. We send signal without even realizing it. It is continuous. Even when we are silent, we still communicating. It can complement or contradict what we say, like saying "I'm fine" while frowning. It's cultural influenced. A gesture that feels polite to one person may feel offensive to others. It conveys emotions more effectively than words can. We all do this every day, often without realizing. And finally, its context depends. Some nonverbal cue can move some things totally different depend on the situation. Understanding these elements help us become more intentional and effective in how we communicate non-verbally. Application in practice. Let me show you how this plays out in real scenarios. Case study number 1. A nurse enters a room and notices a patient with clenched fists and tensed posture. Clear signs of distress. Rather than reacting abruptly, the nurse stays calm, uses open posture and speaks softly. De-escalate the situations before it even starts. Case study number 2. A social worker is with a grieving family. Instead of overloading them with words, they offer present, a gentle touch, a soft voice, and compassionate silence. Sometimes just being there says enough. Case study 3. During a sensitive conversation, a practitioner maintains warm eye contact, nods while listening, and laying in silence, sending the message, "I am here, I care, I am listening." These small, quiet actions build trust and connection, even in the most challenging moment. These aren't great gestures. They are small, intentional action that makes care feel personal. Strengths. So what makes non-verbal communication such a powerful tool in care setting? It builds trust and empathy. A gentle smile or calm tone can make someone feel seen and safe. It clarifies our words, adding tone, depth, and meanings. It sharpens our observation skills, help us to notice things like discomfort or distress even before anything is said. It's incredibly helpful when there are language barriers or speech impairments, where gestures and expressions bridge the gap. It promotes active listening throughout eye contact, nodding, and mirroring. And it gives us constant feedback, helping us read situation naturally and respond accordingly. In short, non-verbal communication helps us deliver care that feels more human, less clinical. Limitation. But of course, it's not without challenges. There is always the risk of misinterpretation. A folded arm might mean someone's cold, or it might be read as defensive because it is often unconscious. We might send the wrong signals without meaning to. In remote or virtual care, like phone calls or video consultation, many of these cues are lost or unclear. Sometimes it can contradict what we are saying, which can cause confusion. It's also highly objective. A gesture meant to comfort one person might overwhelm other, and it is deeply contextual. The some touch or looks can feel warm in one moment and overstepping in others. So, while it's powerful, it requires thoughtfulness, sensitivity, and awareness. Adaptation. Now, here is where it gets really important. Adapting non-verbal communication to the individual. First, we need cultural awareness. What is friendly in one culture, like eye contact or handshake, could feel uncomfortable or inappropriate in other. We need to adjust for vulnerable groups, like those with dementia or autism, who may need soft gesture and more predictable presence. Respecting personal preference is key. Some people appreciate a gentle touch, others may not. With visual impairment patient, tone of voice and soft touch become essential. And in high stress environments, calm and grounded body languages can make all the difference. It is not a one size fits all approach. It is about emotional intelligence and respectful responsiveness. Improvement strategies. So, how do we strengthen our non-verbal communication? Through training on body languages, cultural sensitivity, and situational awareness. By welcoming feedback from colleagues, mentor, service user, their family, patients. By reflecting, asking ourselves, did I come across as open and supportive? By observing role models, those who communicate effectively through presence and posture. Through role play or stimulation, safe spaces to practice and learn. And by listening to patient feedback, because how we made them feel often matters more than what we said. The more meaningful we become, the more powerful our communications becomes. Reflection and conclusion. Working on this presentation really made me reflect on how much I communicate, even when I am not speaking. I have come to realize that non-verbal communication isn't just a soft skill. It is a clinical skill. It can calm someone, comfort someone, and even restore their sense of dignity. Going forward, I want to be more intentional with how I show up, with my tone, my gesture, my present. Because in health and social care, every interaction is an opportunity to build trust, to reduce fear, and to make someone feel seen. Thank you so much for listening.